It's the Kerri Kasem podcast with Ashley Marriott, and we're doing a very special edition of the podcast today. Yes. We're inviting back people that haven't been on the show for a while, but we've seen them almost every week. I have.
You have.
I have. How are you doing, Ash?
I'm good. As you know, I was researching how to get a more cost-effective boob job.
Yes.
And I did find something that really has worked.
I see it, and I can't believe, and it's all natural.
It's called pregnancy.
Yeah.
And it's totally free, and your boobs get bigger.
That's fantastic. No, but
it's great.
For everybody that doesn't know, we haven't been on the air for a while. Ashley is pregnant, so congratulations.
Thank you.
Yes, that's awesome.
I know you're very excited.
So excited. I'm actually excited. Come on. Years ago, I probably would have been bummed because we wouldn't be able to hang out as much.
Yeah,
but
good.
I'm excited for you. But let's say hi to our guests.
Yes.
Welcome back to the show, Dr. John Shieh and his gorgeous wife, Floy. And you may remember Dr. John Shieh. We've done specials with him. He's a specialist in anti-aging and skin rejuvenation, also body sculpting, and you've been doing it for the past 11 years. Now, a lot of people may recognize you because you've been on Entertainment Tonight, Keeping Up with the Kardashians. That's how I found you. Extra. You've also been in a ton of publications. And Floy, you manage and you're a consultant at RejuvaYou Medical Spa, which you two own.
Yes, thank you for having us. We're excited to be back.
Thank you so much, Kerri, for having us.
Oh, come on, always. And I see you two pretty much every week because I'm doing this incredible laser that is brand new, and it's called the Spectra laser. I'm saying that right, correct?
Yes.
And for those of you who know and who've been listening to this show, I have been going to you guys for like almost 2 years now, and my skin has never looked better. I mean, I'm talking about when I was in my teens and my 20s, I have better skin now, almost 20 years later.
I can verify that.
Yeah.
Because we were young. We were still in our teens when we met. Way back then.
We were.
Still young. Kerri, you had great skin, but you always dealt with a few issues like discoloration,
yes,
even from a really young age, and it's completely gone.
I have better skin now. I'm telling you, I get more compliments now on my skin than ever before. And this is the oldest I've ever been. I'm only getting older.
Well, that's a good thing.
You look amazing.
Thank you.
No alternative to aging.
No, there isn't. There is an alternative to aging. It's called RejuvaYou. I'm telling you. My skin looks phenomenal. Now, I did have a problem with brown spots constantly coming back. Constantly. And I was doing the IPLs, the Matrix, all the other lasers that you offered. My skin would look phenomenal. And then there it goes, these brown spots. And I thought they were scars because it just kept coming back. And it was right under my eyes. I had a little bit on my nose. And I was so bummed. So I remember, Floy, you said, you could have melasma. Like, what's that? You said, well, it's created by your hormones. And a lot of people, when they're pregnant, they get this pregnancy mask. Have you ever seen that? It's when it's kind of like you get a dark mustache, you get it on your cheeks, you get it on your forehead. And I said, yeah, I've seen that. And you said that's probably what it is. So I talked to Dr. Shieh. He's like, yeah, well, we have a new laser coming and it's called the Spectra. It's for melasma. Now I've been on this thing now for about 8 weeks and I am mystified. I am in awe. I am happier than I've ever been with my skin. My brown spots are gone and you can see this. And we're going to show, I'm going to definitely show you some before and after shots. But can you tell me how this works?
Yeah, well, this is really a breakthrough for us. It's been just a miracle that we've been looking for the past 10 years. And finally, the FDA approves this new laser last year, and it's FDA approved for melasma. Really, it's a huge breakthrough in our industry. I'm surprised it didn't get more press because of how dramatic this treatment can affect people. Women have this, and I think a lot of times women maybe hide from it, or it's embarrassing. So you hide behind makeup and thick foundation, and you don't want to talk about it, and it affects people deeply. Their self-esteem is affected by it. So this device, this laser, works because it's a very advanced technology. Unlike old lasers that would burn your skin or burn the cells and damage them, that would just irritate and inflame the melasma and make it come back. So you'd hear about people that had melasma or they didn't know they had melasma. They went and got a laser treatment and they came back with dark spots on their face. So this new device, because the pulses are so quick and short, it doesn't overheat the skin, but it works inside the cell to reduce those pigments. But the other thing is that in melasma, there are abnormal cells that produce the pigment. Instead of just suppressing the pigment of the melasma, the color, it actually changes those cells into a normal shape and normalizes those abnormalities. That's what we like to do at RejuvaYou. We want to do things that are more than just cosmetic, but we want it to actually change what's inside. We want to make what's inside actually better. And the Spectra laser actually does that.
So now what if it's not melasma, but you have brown spots and it's not necessarily hormonal? Would this work as well?
Yeah, so the Spectra device, there was a treatment it was just called laser toning, or the Spectra Peel laser toning, and it was a great type of treatment for people who didn't want any type of downtime. You could have a treatment and you go back to work or go to your dinner meeting or lunch meeting or go out that night. Nobody would know you're having a laser treatment done. But when you had these treatments done, the skin would just start to take on a healthier glow, and your complexion would improve, and you just maintain the skin. Nobody knew you were doing anything. What they found was, over time, the people who also had melasma, their melasma was starting to fade. And that's where they started doing more studies, and the FDA finally gave it that approval. But it can be used for people who have some problems in their skin, pigment issues, and they want to still improve it, but they don't want any downtime, or they can't afford to take off time to do this. So in our busy schedule, it's ideal.
Can you tell us, Dr. Shieh, how we know for sure if it's melasma or just like a brown freckle or spot from the sun? What's the characteristic that's different?
Yeah, to know for sure, usually you'd have a skin professional look at it, have your doctor look at it, but there are telltale signs. Typically, if it's a sun damage, sunspot, we call it a solar lentiginous, but lay people, we might just say it's an age spot, liver spot, freckle, sunspot. So normally sun damage type spots would be more random, just freckles, spots randomly around the face. In melasma, you'll notice a certain characteristic when you see a lot of melasma cases. It tends to be sometimes just on the upper lip, like a mustache, and it tends to be symmetrical. So you have an upper lip, maybe it's below the lower lip around the chin area, then you'll have it on the forehead, but if you have it on the right side, you'll also have it on your left side. Sometimes it's not on the central area, it's more on the cheeks, and you see it on both cheeks, and that's what Kerri was mentioning. She had some areas right below her cheeks, so it tends to be something that's on both sides, somewhat symmetrical, and instead of just discrete little random spots, they tend to be a darker patch or a shadow. Sometimes it's not that dark. It could be a deeper shadow that you just wonder why it looks a little bit darker, but it's on both sides. And typically you'll relate it to something like you started birth control and you saw this, or you're pregnant and it showed up. But it doesn't have to be with birth control or pregnancy. It could be just stress, hormone imbalances, and men can also have a similar type of conditions. And usually a lot of sun exposure causes this. So you can tell if you have it, if it's symmetrical and kind of a deeper pigment.
Now, I know Ashley had the IPL-RF, another laser that's great for brown spots. It takes
got rid
away
of my freckles.
Yeah, it got rid of everything. All your sun damage is gone. Now, she did it one time. And whenever I tell people, is this downtime? I'm like, what am I going to have to do? Am I going to have to do, a series of it? And yeah, it's great to do a series. Ashley did hers one time. And
I want to go back for more.
Yeah.
But now I want the Spectra.
Yeah, the Spectra is amazing. But you're pregnant right now.
Yeah.
Can pregnant women, while you're pregnant, get this laser treatment?
No, you're not supposed to.
Damn it.
Yeah, during pregnancy, we usually just... you just lay off of any elective type procedures, just for safety. But really, these laser treatments are just very superficial. Well, at least just in the skin. Technically, should it affect the new baby? I don't want to say that it's not going to, but really, there's other things that we do in our life and our diet and things that we do that could affect it more. But we want to give our baby the best chance, so we'd hold off on that. And we have plenty of time.
It's a good push present.
Oh yeah, push present. You have plenty of time afterwards to make it great.
And besides all the lasers that you offer at RejuvaYou, you offer so many different things, like from skin tightening to cellulite reduction to liposuction. There's a whole range of things you offer at RejuvaYou, which I'm very, very happy about because I've tried out most of them and they're awesome. So the show is really, we're talking about melasma, we're talking about the Spectra laser, but I want people to know that you offer so many things at RejuvaYou that are just so phenomenal. So if you don't have melasma, there's other things that you guys offer.
Yeah, definitely. The melasma does fall in that first category of a skin aging that we try to help people with. And we usually, actually, at RejuvaYou, for the skin or the face, we have a 5-step approach. Part 1 would be discolorations of your skin, which could be melasma or it could be the sun damage spots. So Ashley, you had a treatment that was our photofacial RF, the IPL RF treatment that helped to clear the blemishes, the brown spots, and it helps shrink the pores and helps the fine lines, helps the collagen. We know the skin actually becomes a healthier, younger skin with that treatment. And normally we do 3 treatments. With 1, people definitely already see changes. And if we could do the other 2, it would be great. If you have melasma, which is also a pigment issue, then we use the Spectra. Part 2 would be laxity of the skin. As we age, our skin gets a little looser. So maybe in our 40s, it starts to droop a little bit, and we can restore elasticity and shrink the skin, help it to contract, and help you avoid having to cut and pull, because that's not really a great option. That's kind of like allowing your skin to degrade to the point that you're having to resort to this last-ditch effort. It's like not taking care of your health until the point you had to have a heart coronary bypass surgery when you could have started early,
right,
and just stayed healthy and exercise, eat well. So part 2 is help firm your skin. Part 3 is help you with texture or wrinkle issues. We have special lasers for that. The 4th thing we see with aging of your skin is volume loss. Volume loss means your face shape changes, and maybe below your eyes it gets kind of sunken in and looks like you have eye bags or hollowed out cheeks. The cheeks sink in. The nasolabial folds, the line below the nose going towards the corner of your mouth, starts to become kind of sharp, and that looks deep. And those are just volume changes, and we can fill those. That's where
those are the injectables.
Yeah, then you can use an injectable filler, which could be something like Juvederm, and that lasts for about a year. And it's a component of our collagen that we're injecting. Or if somebody who needs a lot of filling, let's say they need it on their temples, their eyebrow, below their eyes, the nasolabial folds, then we'll use your own fat. And that's actually becomes more economical, and it's actually your own living fat, which feels natural because it is natural. It's your own living fat cells, and that's what you lost, and that's what we'll put back. So that's the 4th thing. The 5th thing is to help protect what we've done now by utilizing things that can help, and one of them is Botox. So if you look at that approach, Botox and fillers aren't the whole picture, which often is overdone in a medical spa setting because it's easy to just inject it into you. But what we want to do is make sure you're doing everything in balance. Everything should be done in context of everything else, meaning if it's laxity of skin, don't overfill your face to make up for your loose skin, because then you look like a pillow face and it's blown up.
I've seen it.
There's a characteristic look on Housewives of whatever
Blank,
city you
blank.
want. Yeah. Or they over plump things so it doesn't work. If you have laxity, you can firm the skin. Don't cut and pull it, just firm it up and then fill just enough that you need. If you have wrinkles, there are lasers to help smooth the skin and help reverse the wrinkle. Then you just use the Botox to help prevent it and in strategic areas, but don't over Botox your face and paralyze it, because there's no youthfulness in a paralyzed face. I have 2 young kids now, and their faces are very dynamic. That's youth. Who's frozen? Well, probably some people that we've seen on TV that are older and desperate and didn't know what else to do, so their faces are completely paralyzed. They're kind of defining the new look of an old person, which is a paralyzed face. We don't want to paralyze your face. Just use Botox strategically where you need it and in balance. And if you approach it this way, everything's very natural.
Like I've been using Botox for many, many years, and I've said to you when you do my Botox, I need to move my face, and I always say, no, just make sure I can still move my face. And every time I walk out of there, I look natural. I can move my eyebrows. I can move my face. I can make facial expressions. And that is how Botox is supposed to be done. It's not supposed to be where you can't, your eyebrows are just stuck in this surprised kind of look. Or,
Right.
I've seen people who Botox their lips where they can't smile correctly, or they've overfilled their lips to where they look like ducks. And that is not what unfortunately, when people hear Botox or they hear filler, they go immediately to the housewives. They go immediately to these cases where they look awful, but they don't know all the other actresses that look natural. And because those actresses aren't going to say anything. They don't say, I use Botox, I do this. And those actresses, which I'd say probably 60, maybe 70% of older actresses do have filler, do have Botox, but it's done so well, you don't know. And that's the kind That's the kind of injectables you want to use. And that's the kind of doctor you want to use. Somebody who's going to keep you looking natural. So, I mean, Dr. Shieh, every time I've walked out of there, all I get is compliments. Nobody will ever guess my age. And I love that. And there's two other people I definitely want to introduce right now. Two guests. They're testimonials. They're Dr. Shieh's patients. We have Anita Lee and her daughter, Jennifer Lazo. So, hi. Don't be shy. I actually asked for you, Anita. I said, I saw a woman in the waiting room.
In tears.
In tears. No, but you weren't in tears when I saw you, but you did have I guess it would be called the pregnancy mask. It was all over your face.
All over my face.
Yeah.
Oh.
And
I was a mess.
And I said, I want her to come on the show. How does she look now? And they said, no, it's not only her, it's her daughter too. They've been coming and getting treatments. It's unbelievable what they look like. I said, could you ask them to come on the show? So can you talk a little bit about your case and what went on?
Oh, sure. About a year ago, I started getting on upper lip. Well, we call it baño, but like a mustache. And it was just awful that I didn't want to go anywhere. So my daughter gave me a birthday gift. And she says, I'm going to take you to a doctor that's going to fix it for you, Mom. I says, really? I said, there's doctors that can do that? I mean, I tried creams and everything and nothing would help. So she took me to this doctor recommended by a friend. So I went for one visit. And when we came back within 2 weeks, not only did my mustache get darker, but I got it on my cheeks, my jaws, my forehead, my eyebrows. And we left in tears. And then she says, Mom, I'm going to call Dr. Shieh. He's going to fix it for you. I says, Jenny, I don't want to go anywhere. I says, I just want to go home. Well, she called Dr. Shieh. I was kind of reluctant to go. And I thought, oh, no, they can't do anything for me, So we went. And he has a great staff. They encouraged me. He told me within 6 to 8 weeks. By the 5th week, maybe the 3rd day after that, oh my God, I wanted to run to Dr. Shieh's office and say, look at it, it's finally working, And I've been so pleased. And everybody has told me I don't have to wear the heavy makeup. My face looks great. I use the lotion, vitamin C for, I guess, wrinkles.
Yeah, the vitamin C and the Skin Bright as well. Do you do the Skin Bright? It's phenomenal.
And so I'm very pleased. And when he told me that, he wanted me to come on, I says, I'd be happy to come. Anything I can do, because there's a lot of people out there my age and will shy away, says, no, we're stuck with this face,
Yeah.
And what he did for me, I mean, I couldn't say enough about it,
Oh, so it changed your life. Did you?
Oh, yeah.
I mean, your skin's so gorgeous. I would never know that you had any discoloration.
Oh, until you see those pictures.
And yes, in which we're putting up now.
So, Dr. Shieh, what was the first? Did she have just a laser treatment before that made the melasma worse?
Oh, yes. I had this treatment with this other, she's not so a doctor, but she gave me this treatment. And I think it was just she must have thought I just had like spots, and it wasn't that. She didn't know that I had, well, I didn't know this. I just thought it was, well, we call in Spanish, baño. Again, it's like when you're pregnant, but I haven't been pregnant in over 40 years, And it just came. And no, she treated me terribly wrong.
Yeah. Yeah.
I think that's a cautionary tale because on every corner, at least in Los Angeles, there's laser ads and little, med centers. Oh, come in and get laser treatments. I would never feel comfortable unless it was someone like Dr. Shieh, because I think there is a lot of risk involved when people don't know what they're doing.
Absolutely. And then Jennifer, you had like dark spots as well.
I did. About 3 years ago, I developed 2 dark spots on each side of my cheek. And like herself, I did the creams, followed my mom's advice. Nothing would work. And I just felt so embarrassed. You didn't want to look anybody in the eye because you didn't want to see them looking at your face.
Yeah.
So another friend had recommended RejuvaYou and to go see Dr. Shieh, and I did a photo facial. Oh my goodness. After a week, my face was beautiful. I mean, never could I have gone out without no makeup, and it looked as though I had makeup on. It was just amazing.
I'm so with you because I always had to wear makeup. And when you can actually run to the grocery store, go get a coffee, or just do something without makeup on and not feel embarrassed,
Right.
it's amazing. It's the best. It's like freedom. I sometimes come to work and I'm not wearing any makeup. And I mean, and my co-host on one of my other shows teases me. You know, he's always like, well, you know, it's your age. You got to wear makeup at your age. Not wearing anything. But yeah, no, it really does change people's lives.
It does.
It did mine.
Yeah.
Very much.
Yeah. I
So much confidence. Back to myself again, you know? I would know when I would come into the office, thank God, she was always there and encouraged me, and all his staff encouraged me. I says, how you doing? I says, I'm doing okay.
Yeah.
You know, but
Yeah.
down deep, I mean, I just wanted to cry. I says, Jenny, this is not working. Jenny, this is not working, you know. But we went faithfully, and, you know, and it finally worked. It really
It's
did,
so
you know.
great.
Now, it is. That is wonderful. And you were saying at your age, or you were commenting about, you know, at my age, but the Spectra can be used pretty much from your teens on up.
Yeah, the Spectra, it's a treatment that really is for everybody. I mean, if you have a condition such as any kind of aging, if you feel like you need a little boost or glow to the skin, Spectra is a good one because there's no downtime. It's very easy to do. It's probably the most comfortable of all the laser treatments that we offer. So people really love it for that purpose. And then if you happen to have melasma, it's perfect for that. But you can get melasma whether you're in your teens, because, you know, even birth control, pregnancy, on into people, and even after menopause, you could get melasma. You know, just because your hormones have declined, there are still some other hormones that are in the body from stress, other things that can trigger that. And then, of course, sun exposure. So the story we hear with Anita and Jennifer, it's probably the typical kind of common story. And actually, it's probably much more prevalent than we think.
Yeah.
And then their experience with maybe getting a laser done and then worsening the melasma, that's actually very common. And it also reflects the lack of awareness about it, because this doctor or nurse that had treated her, which, you know, wasn't in our practice, didn't know how to recognize the melasma. And so what happens is they treat with the different device that's not appropriate, and then ends up worsening the condition. And it really brings out the rest of the melasma. And then luckily we can utilize the Spectra now. I mean, if it was a few years ago, we didn't have this option, but now we can use the Spectra, and it is a series of treatments that we have to do over time.
Now, I know that I went in and I had, before I knew that I had melasma, I had all the IPLs. I had the matrix and everything, and it would go away for a little bit. And like you, Anita, it would come back so much darker. And I kept thinking, I was so frustrated. What is going on with my face? What is happening? And yeah, you have to go to somebody who can recognize it's hormonal. That's melasma. That's not sunspots. That's, you know, I kept thinking, maybe my sunscreen's not, you know, strong enough. I have to wear, I even tinted my windows. This is no joke. I have UVA on my windows because I kept thinking, okay, I must have really like sensitive skin. And then I realized, okay, it's melasma. And I thank God for Floyd. That's all I can say. Floyd was the one who recognized it, you know, when I said, hey, I keep having these dark spots. But Floyd, I know that you are an aesthetic consultant at RejuvaYou. You must see a lot of women who come in and who are really upset or embarrassed.
We actually see it quite often. So when the Spectra came out, when Lutronic came out with this device, I was so excited because all of these consults, I mean, I'd go in and I'd look at their skin and I'm like, I'd recognize that it was melasma. And previous to this, we were doing bleaching creams, but the problem when you're doing bleaching creams and all the different things, there's irritation, there's sensitivities to the sun, there's a lot of peeling, and there's a lot of downtime involved with all of these other ways that we were treating the melasma before. But now with the Spectra, the best thing I could tell a patient was you can come in, It might be 20 minutes to numb your face. And then some people don't even use numbing cream.
I don't. It doesn't hurt. So I don't know why you'd numb somebody. Are they scared of the laser? Is that why?
Well, I think it's the pitter patter because it goes.
Oh, it does. It makes a loud noise.
It makes a little bit of a
but
scary
it doesn't
noise.
hurt. It actually tickles. I laugh sometimes when it goes on my face. Yes.
She's a masochist.
I was not laughing.
It tickles me so much. I'm like, stop. And I start laughing. But yeah, I guess everybody's sensitive to, different sensitivities. But it's you're in and out.
You're in and out fast.
Yeah.
There's no downtime and your skin looks better than ever. Your pores, everything, the texture, things look great. It looks really bright. So it's one of my favorite treatments. It's really recommended to patients. And I always tell them, you can come in and in 15 minutes, you're going to look great. You're going to feel great.
Yep.
I think with women, most of us want to get a treatment where you get results and then you feel great after and you can see the difference
immediately. And you can go out the next, you can go right back to work. It is really what they call that lunchtime peel. You can run in. It's so quick. If you don't do the numbing, it takes me 15 minutes. I'm in and out. If you do the numbing, it's about a half hour. You're in and out and you look phenomenal. And I have, unfortunately, I have more hair than I'd like on my face.
She's a furry creature.
I'm a little furry. But this is they don't say this, but an upside to using lasers is your hair goes away. I haven't had any hair growth on my face. It is phenomenal. And I'm so worried that I'm pretty much almost done with my treatment. My skin is perfect. I think I have a couple more to go and I'm done. And I'm really worried that my hair growth is going to come back. My skin's not going to look as good.
Your little beard and mustache.
I finished my last treatment, I believe it was back in September. And I just went to see the doctor this week. So I hadn't seen him for about 3 months, maybe 4 months. And my hair just started coming back a little bit.
Oh.
I had facial hair too.
Oh, yeah.
Dr. Shieh, what's the recommended treatment protocol? I know everyone's a little different depending on the severity of the melasma or what you're treating.
Yeah, we usually let people know that because of how this treatment works, it's very advanced. It's high energy, high power, but it's in very short pulses. So it's actually very effective on what it's trying to do, but it's gentle on the skin. But with melasma, we do have to treat it very carefully because if you over irritate it, it'll cause melasma to come back darker again. So we're trying to fade it. So it is a series of treatments, and we usually do about 1 treatment per week, up to about 10 treatments on average. Some people, though, it's sooner. Like with Anita, we started her treatments, and we were doing it weekly, and after about 4 or 5 weeks into it, which we usually let people know at 4 to 5 weeks, you're probably not seeing anything yet. Some people do start seeing changes, but most people don't see anything yet. And she was actually getting very frustrated. That's why she said she'd come in and she needed a pep talk and just encouragement.
But it's going to be okay.
Yeah, actually,
Everyone needs
I remember.
Everyone
yes,
needs one of those.
yes, we do.
I remember she came in and she was pretty discouraged because she didn't see changes yet. But you're not supposed to see it that quickly. And after we saw her in the office, I thought, wow, she's probably not going to come back again. So the next week, she actually shows up, and I thought, oh, good, she shows up. But when she walked in, my other staff looked at me and said, did you see her? And we're like, yeah, is that makeup on her? And they're like, no, there's no makeup on her. She looks so much better. So within a week, there was a big change. She went from, I'm really frustrated, it's just not working, to next week, suddenly it was great. And then the following week, it was better than that. And so we let people know, your skin has I let people know their face has about 6 weeks worth of skin on their face. Meaning any new skin cells being born today that are being created, it's going to take 6 weeks before it gets to the surface and then sloughs off. So in the melasma, in that sense, there's some pigment that's just sitting on your face. It's not coming off completely right away. Now, the IPL RF treatments really bring them up, and within a week, they just fall off.
They're gone.
But this one is doing it more gently. It's breaking it down so your body, you have to wait for the skin to push it all out. So usually we let people know it's about 10 treatments. Some people within 4, 5, 6 treatments, they're already starting to see the results. And then afterwards, we'll do maintenance. But maintenance could be different on everybody. Some people, they get no recurrence, and a year later, they think, well, maybe I'll do some just because they want skin rejuvenation. Then there's some people, if their hormones and their body, what's inside is still trying to bring about new melasma, it's possible to get melasma to still come back. And so those people might have to do 1 treatment every month or 2, or And it's at that point, it's not even just for the melasma. You kind of want it anyway, just to give you a nice glow to your skin. So it's a benefit. I mean, you get the best of both worlds. You get your melasma taken care of, but you have nice skin. Now, hair growth, this type of laser happens to be really good for that fine hair.
Yeah.
So that's what you guys are talking about, because normal laser hair removal is for dark, thick hairs. And then the fine ones, they say, well, we can't get those. But now with this type of treatment, because the way the energy is delivered, it can help with the fine hair reduction.
Yeah.
So that's what's great about
Nice
it.
bonus.
Yeah, it's a great bonus. And
Great bonus.
but so this technology, it is quite a breakthrough. I mean, it's that miracle we've been praying for the past 10 years for melasma, but it's also that type of technology that allows us to have other types of effects, such as tattoo removal without scarring the skin. We're not trying to burn that tattoo away and then you have to replace it with a scar. What we're going to do is use these really nanosecond, which is a billionth of a second type pulses that break up the pigment in the tattoo so that your skin it just fades from your skin, not scarring it. So there's a lot of things that we can do with this.
That is fantastic. I mean, so many things. And we're lucky. We live in Los Angeles. We live in a big city. So this technology tends to come to us first. You know, New York, Los Angeles, maybe Miami, maybe Chicago, you know, the bigger cities. But what if people aren't in a big city? What do they do then? Do they just wait for this technology to hit them?
Well, if you
Do a road trip. Come to Pasadena.
I don't know what else to say. You should try to find somebody that has the right technology. But if you just go to a place, they might just try to give you what they have.
Right.
And they'll try to utilize a different laser and they'll say, yeah, this can work on melasma. So in the past 10 years, I've done I think about 170 presentations, seminars, conferences at anti-aging conferences, laser seminars. And I'll hear doctors share what they think could work for melasma, and knowing that there really wasn't anything at that time. And they would try a fractional laser. They would do some kind of IPL, some laser, and maybe they got lucky once or twice, but you definitely do not want to do those things. So I would still approach it with caution. Ask them, is this FDA approved, or has this been FDA approved for melasma? If it's not, I would be very cautious about utilizing those energy-based treatments, those lasers. But there are creams that you would use. Treatments for melasma that people commonly know about are hydroquinone, which is like a bleaching cream that suppresses melanin production. It suppresses the production of the color. There's a Retin-A that you use with it. Other things would be vitamin C serum, pure C. There are more natural type of skin lighteners now.
What about Cosmoline?
Cosmoline is a brand name for another type of skin lightener that uses a combination of natural skin lighteners that are not hydroquinone. Okay. So there are different things.
Some people want to avoid that because they're worried about health risks.
Well, yeah, but then my girlfriend had it and it worked for a while, but then, like you said, it always comes back.
Right. Yeah. Because it's the topical creams you're doing, what they do is it suppresses the chemical process in the skin that makes color. So in the cells, it makes the color called melanin. Actually, melanin gives us our ethnic look. You know, so I have more melanin than Ashley, and then you're probably in between us, and Elijah is different than, Anita. And and it gives us our ethnic look. If you lose all the melanin and you see it in people like that, you see people that they all look white. Everybody ends up looking Caucasian. Right. Even though they started out differently. But those are conditions that we see like in Michael Jackson or something.
Yeah, right.
So the melanin is produced by this chemical reaction in those cells called melanocytes. Now these creams basically slow down that production. But see, melasma is not just that it just happens to make more in that area. What happens is those cells are actually abnormal. These melanocytes that make color, they become enlarged and they have these appendages like tentacles that reach out. Normally they're just thin, small ones that branch out from the melanocytes, these color-producing cells, and then they feed color to our skin cells, and they give us a certain color. In melasma, these little appendages are actually overgrown, and they extend quite far through the skin, and they're pumping a lot of color into your skin cells, so it looks darker. The bleaching creams just slow down production, but the cells are still abnormally shaped. They still have these large tentacles reaching all over the place. With the spectral laser, it actually causes those appendages, those tentacles, to shrink back down into normal structure. So that there are studies using 3-dimensional electron microscopy where they can 3-dimensionally look at cells in your skin, and they found that they were abnormal in melasma, but after the treatments, those cells regressed into a normal shape. Wow. So that's how that works.
Very cool.
And this is only with the Spectra, which is FDA approved for melasma. So other lasers are not going to have that effect.
Correct. I mean, there are going to be other lasers coming out now that they know this technology, they understand it, the nanosecond type, very short pulse called the Q-switched ND-YAG laser is technically what it is. And it's very short pulses that is what's able to accomplish this. There's going to be new lasers, other companies coming out trying to sell their version of it. But the Spectra was the first one that was FDA approved last year, and probably the only one that was last year. And then now there's probably some other lasers that are trying to ride in on that, copycat it. But that is, the horizon for us is great.
It's so exciting.
I mean, it's a great time to be aging, to have these skin conditions.
It's true.
Hey, thank you.
because we have those solutions for you. In the past, it was, hide it as much as you can with makeup until you do some surgery. And that really didn't even address the problems.
No.
The skin is still old. So what we want to do is help you using these early intervention things that are minimally invasive to help avoid things that are later that are more drastic, that leave you unnatural.
Now, you can find Dr. Shieh at RejuvaYou. We've put up all the links at the KPOD.com. Also, if you're listening to this show on your computer or from your iPod, we actually had Elijah film the entire episode. And it's going to be up at RejuvaYou, and we have a link to that as well. We're going to put everything up at the KPOD.com, but you got to check this out. Take a look. Not only did we shoot the entire podcast, we have before and after shots. We can also put the before and after shots up at the KPOD as well. Yes. But you can find all of the information, where to find Floyd, where to find Dr. Shieh, up at the KPOD.com. And don't forget to take a look at the show. I want to thank you, Anita and Jennifer, so much.
Thank you for having us.
Yeah, for telling your story and for being brave enough to come out and say, this is what I had and this is what I had to do to get rid of it. Yeah, a lot of people don't want to talk about it. A lot of people don't want to talk about things that they've done to their face.
They hoard all the good stuff.
They
Thankfully,
do.
Kerri, she's a loudmouth. She'll tell everyone.
I am. I look at,
She stops people on the street and says, you have to go. Yeah. She had me on the cell phone the other day with a random person to say, because I was a doubter with the IPL. And she said, tell him what happened to you. And I said, all my freckles went away. Click.
Yeah, so now you're going to have another one of my friends hitting you up very soon. But yeah, so take a look. And I know there's a lot of information here today. But if you go away with just one thing, knowing that something can help you, and that if you do have melasma and if you're embarrassed about your skin, you don't have to go under the knife to fix it. You don't have to do these horribly invasive treatments. There is Dr. Shieh and RejuvaYou Medical Spa. So thank you so much.
Thank you.
Definitely.
Thank you, Kerri.
All right.
Thank you, Kerri.
Thank you, guys.